Hello everyone. The topic of today's discussion is iatrogenic lesions. The lesions that are caused by doctors during any procedure. The word iatrogenic, it comes from Greek word iatros, that means healer or physician, and the genon means as a product of. So iatrogenic means due to doctor. So why these iatrogenic lesions are important? The clinical application of hundreds of new therapeutics and diagnostic agents in the past few decades has added iatrogenic problems as a new dimension to practice of medicine. The iatrogenic changes occur in diverse situations, ranging from the benign hyperplastic endometrium in women taking estrogen to life-threatening radiation-induced malignant tumors. Firstly, we will discuss the reaction to diagnostic procedures. So first, very common procedure, biopsy. Biopsy, it can lead to distortion of tissue that can alter the architectural pattern as well as the cytologic details. It may cause compression and disruption of the nuclei, and most commonly in small biopsies. When we are taking small biopsies, it will lead to compression and disruption of the nuclei, particularly of lymphocytes, neutrophils, and cells of Ott cell carcinoma. Biopsy can lead to necrosis and hemorrhage along the edge of incised tissue or the needle tract. Regenerative and degenerative changes, they include atypical epithelial cells, reactive endothelial cells, and proliferation of fibroblasts. Biopsy can lead to necrosis of fat in breast. If biopsy taken from breast, it can lead to necrosis of fat. Degenerating fat cells or reactive histiocytes may mimic adenocarcinoma. Endocervical cytologic specimens can yield suspicious glandular cells for years after conization. Confusion with adenocarcinoma in situ. So after conization, the cytologic specimens may yield suspicious cells for years. Surgical specimens of mucosa from oral cavity obtained after biopsy may contain reactive changes in minor salivary glands. Degeneration of lobules leading to degeneration of lobules, squamous metaplasia, and complex branching arrangements. Colonoscopic polypectomy sites, they have acute inflammation, then granulation tissue formation and resurfacing of the normal mucosa. Second procedure is thermal electrocautery leading to thermal artifact. It is found in specimens obtained by electrocautery or laser. Present often in transurethral resections, the signet ring configuration of lymphocytes and stromal cells. Cytologic artifacts in small colonic polyps. Granulomas with central necrobiotic zone surrounded by palisaded histiocytes and diathermy pigment. So, electrocautery will lead to granulomatous reaction against the diathermy pigment. Hysteroscopic ablation in endometrium, it may result in hard thermal residue and foreign body reaction. Loop electrosurgical excision procedure in cervix, it produces thick zone of densely eosinophilic coagulation underlying thin superficial of carbonization. Then implantation of normal epithelium. Normal epithelium will be implanted in these procedures. Intradural extramedullary squamous cell lined cysts, that are epidermal inclusion cysts, they may be seen at the site of lumbar puncture. Benign breast epithelial cells transport to axillary nodes in FNAC procedures. Then hyperplastic mesothelial cells may be implanted in lymph nodes. There may be implantation of abnormal epithelium. So clumps of adenomatous cells from tubular adenomas in submucosa after removal. So after removal of adenomas, the clump of adenomatous cells from tubular adenoma, they can be seen in the submucosa. Fragments of epithelium dislodged from DCIS into the stroma, subcapsular sinuses of nodes, and lymphovascular spaces in breast. Now next procedure is FNAC. FNAC, fine needle aspiration cytology. It may cause acute hemorrhage, inflammation, infarction, fibroblastic organization, chronic pseudoinvasive tracking of the epithelium. It may lead to atypical metaplasia, nuclear clearing, needle track seeding of malignant cells using 22 to 19 gauge needles may be seen, but it is a rare complication. The radiographic media, they are used in diagnostic procedures like barium sulfate on enteric mucosa will cause fine uniform golden granules with little inflammation. So, on enteric mucosa, we will find golden granules with inflammation if barium sulfate is used. Oil-based iodine-containing compounds used in hysterosalpingiography and myelography, they lead to granuloma formation on peritoneum, meninges, and may lead to xanthogranulomatous salpingitis. Reaction to physical and chemical agents used during the procedures. First is starch. Starch, it is present in the glove powder. Starch, the histologic response varies from scattered histiocytes, lymphocytes, neutrophils to granuloma formation. Foreign body giant cell granulomas with necrosis can be seen. These are the giant cells. This is granuloma. Faintly eosinophilic 3 to 10 mm starch particles stain deeply with pus and have maltase cross birefringence. Maltase cross birefringence. Lint is commonly used in surgical procedures. It will also lead to granulomatous or fibrous reaction. Ragged, irregularly shaped refractile pale pink particles. They are seen on histopathology as refractile pale pink particles. Now, cotton fibers, they will also lead to foreign body giant cell reaction. These are the cotton fibers, and you can see the giant cell reaction, lymphocytes, giant cells. Another particle is cellulose. They are faint pink, pass positive, doubly refractile. These are cellulose, refractile, doubly refractile. Then suture material. These are H&E stain slides showing the suture. Multiple fragments of silk are of similar size, but they are round, square or triangle. Polyester nylon, they seen as randomly scattered tiny black specks. These are also cotton fiber, suture material showing giant cell, foreign body giant cell reaction. The embolizing agents that are used in procedures, they will also lead to foreign body giant cell reaction and vasculitis. Now, results of surgical procedure. Implantation of normal tissue, endometriosis, it can be seen in caesarean section scar. Fallopian tube caught in incision at vaginal hysterectomy may produce vaginal masses. Omentum in endometrium following perforation of uterus, and thyroid tissue can be seen in lateral neck after surgery. Parathyromatoses, parathyroid tissue throughout the neck after parathyroid surgery. So, implantation of normal tissue is seen. Reactions of cytotoxic drugs and immunosuppression. Changes in normal epithelium. Alkylating agent used. Biopsies, FNAC, cytologic smears of sputum, bronchoalveolar lavage, urine or cervicovaginal origin may contain atypical cells. After chemotherapy in breast carcinoma, the normal tissue show atrophy of lobules, teardrop appearance on normal fibrous reaction. If we use podophyllin, then it will cause edema, increased mitosis, single keratinocyte degeneration and necrosis, followed by hyperkeratosis and mixed inflammation. 5-fluorouracil will lead to mucositis and non-healing ulcers. The use of BCG will cause caseating and non-caseating granuloma in bladder and prostate. Squamous metaplasia can be seen and mixed inflammatory infiltrate is seen. The use of amiodarone will lead to alveolar infiltrate of foamy macrophages and occasional vacuolated parenchymal cells. Now, changes in neoplasms. They may cause massive necrosis of the tumor, may result in perforation of bowel and cavitation in lungs, maturation of various elements, persistent tumor masses. Drug-associated neoplasms may be seen. Post-transplant lymphoproliferative disorders may be seen. There is seen thymic hyperplasia and non-neoplastic lymphadenopathy. Radiation recall, the inflammatory reaction in an irradiated area during subsequent drug treatment. The effect of hormones used. If diethylstilbestrol is used, it will lead to vaginal adenosis of endocervical type. Tamoxifen will cause polyp, adenomyosis, leiomyoma, endometrial metaplasia, hyperplasia and carcinoma. The progesterone will cause proliferative breast disease, cancer and decidual reaction of endometrial stroma. The oral contraceptive use will lead to inactive glands, decidualization of stroma, thin vessels, pseudoparakeratosis and metaplastic cells in cervicovaginal smears. GnRH agonist, they will cause hyaline degeneration, cytoplasmic contraction with crowded nuclei giving hypercellular appearance in leiomyomas. Endocrine therapy in prostate cancer, they will cause neoplastic gland shrinkage, cytoplasmic vacuolization, nuclear degeneration, inflammation, histiocyte-like cells may be seen. Benign gland exhibit atrophy, vacuolization, basal cell hyperplasia, and squamous and transitional cell metaplasia. This is the pap smear showing use of oral contraceptive. The effect of oral contraceptive that will lead to sheet of pseudokeratotic, metaplastic, small metaplastic appearing cells with dense pycnotic nuclei and fine cytoplasmic vacuolization. The effect of ionizing radiation. The early phase changes will cause nuclear and cytoplasmic enlargement, cytoplasmic vacuolization, amphophilic cytoplasm, nuclear membrane irregularity, multinucleation, prominent nucleoli, bizarre shapes, pycnosis and karyophysis. Phase changes are persistent nuclear and cytoplasmic enlargement with no vacuolization, fibrous reactions in stroma and arterial sclerosis. Acute cellular changes, nuclear and cytoplasmic enlargement with vacuolization, cytoplasmic vacuolization, multinucleation, irregular nuclear shapes and prominent nucleoli. So, effects on neoplasm, effects of radiation, necrosis, nuclear cytoplasmic vacuolization, bizarre cells. In squamous cell carcinoma, it has more keratin post irradiation. Squamous cell carcinoma has more keratin. Undifferentiated nasopharyngeal carcinoma and transitional cell carcinoma, there is increased pleomorphism and cytomegalomy. Squamous cell metaplasia in breast endometrial undifferentiated lung carcinoma. So, we will discuss in detail effects on neoplasm of radiation in next lecture. Thank you very much.